a medical group all across the San Fernando Valley. So Dr. Garbutt practices at our West Hills location, but we have, again, clinics all over the San Fernando Valley and all over Southern California, actually. So really happy to provide quality care here to the community. Our primary care doctors, also with our specialists, our care managers. We also have health enhancement, a health enhancement department that can help you manage your chronic illnesses such as type 2 diabetes, chronic heart disease, COPD, et cetera. So if you guys are in the market for a new doctor, now will be the time to definitely start searching. As you guys may or may not know, we have the care AEP, the annual election period, coming up tomorrow, actually October 15th through December 7th. So make sure you guys are reaching out to your brokers if you have any questions about your health insurance coverage, as well as aligning that with an Optum doctor. So at the end of the presentation, we'll also have our phone number if you guys have any questions, if you're looking for a doctor, and I'll make sure to put our webpage also in the chat. So without further ado, I will key it off to Dr. Garbutt. Thank you.
Can everyone hear me okay? Perfect. Okay. So my name is Dr. Ashton Garbutt. Just to give you guys a little background about myself, I'm over in the Optum West Hills office. I'm a family medicine doctor, so I take care of all ages. Actually, originally from the San Fernando Valley area, did my medical school training in Albany, New York, and then was lucky enough to come back and do my residency training in Northridge at Northridge Hospital. So now with Optum, and excited to talk with you guys about diabetes. So let me see. Perfect. So kind of give you guys a background about what diabetes is. So it's a disease in which our body does not produce or properly use insulin. So there's different types, type 1 diabetes and type 2 diabetes. We'll get a little bit more into the nitty gritty of it a little later in the presentation, but the mainstay is that the body does not produce enough or properly use insulin. And what is insulin? It's a naturally occurring hormone that is needed to convert food into energy. So the sugar in our body is kind of like our cells' gas, and insulin is what turns it into our energy. The cause of diabetes continues to be a mystery, but we know that the following play roles. So genetics. So if your mom had diabetes, your brother, your aunts, your uncles, you're at higher risk of having and developing diabetes. Obesity. So when you're overweight, you have a higher risk of diabetes and higher risk of complications with diabetes. And then lack of exercise. The more we use our bodies, the more energy we use, the more active we are, the better we use the sugar that's in our blood. And so lack of that, we have to figure out how to store it. And so our insulin can be overused. So staying healthy and active is going to be important to stave off diabetes. Okay. So the next slide. So to give you guys a breakdown kind of about the demographic of diabetes. So around 23.6 million Americans, so not a small number at all, have diabetes. That's 7.8% of the population. So definitely not a small percent, especially when you're considering in medical terms, 7.8% is a pretty large number. We see diabetes a lot in our practice. An estimated 17.9 million people have been diagnosed with diabetes, and nearly 1/3 of those with diabetes, so about 5.7 million people, are unaware that they have the disease. So it's something that you should be checking with your doctor regularly to see if you have diabetes and be keeping track of. So diabetes is a spectrum. There's something called pre-diabetes as well. So not having diabetes, but at increased risk for having diabetes. And that accounts for 57 million people in the US. And then new cases of diabetes is about 1.6 million cases in people aged 20 and older each year. So it's something that, definitely affects our population greatly, and something that your doctors are very used to seeing and, have very good experience in taking care of. So we'll do a little bit more about prevalence of diabetes by age. So under 20 years of age, there's about 186 thousand or 0.22% of all people in that age group have diabetes. So about 1 in every 400 to 600 children have type 1 diabetes. So that's the early onset diabetes, and about 2 million adolescents age 12 to 19 have pre-diabetes. So kind of talks a little bit about, or tells a little bit about our society in terms of kind of what's going on with our youth. And then age 20 years or older, 23.5 million or 10.7% of all people in this age group have diabetes. And as we get older, we tend to add a little more weight, so we tend to get a little bit higher percentage. So 12.2 million or 23.1% of all people in this age group have diabetes. So it's definitely more prevalent in the older population. When you split it up by gender, men tend to have men account for 12 million or 11.2% of all men ages 20 or older have diabetes, and women account for about 11.5 or 10.2% of all women over the age of 20 have diabetes. So men are at a little bit more of a risk than women, but not by much. So in terms of total prevalence, again, we kind of touched on this a little bit. So men have a higher prevalence of diabetes. We tend to carry a little bit more weight than women do. And so just in terms of the obesity and things that affect diabetes and affect your likelihood of having diabetes, men tend to be a little bit more prone to getting diabetes. So something to think about for all the men in the audience. And then we're going to break it down now a little bit by ethnic groups and cultural, and by background, excuse me. So we're going to again stay with the ages 20 years or older, so our adult patients. 6.6 of non-Hispanic white individuals have diabetes. 7.5% of Asian Americans, 11.8% of non-Hispanic Blacks, and 10.4% of Hispanics. And then when you break down Hispanic or Latino cultures a little bit differently, or into their individual groups, you have 8.2% for Cubans, 11.9% for our Mexican Americans, and 12.6% for our Puerto Rican Americans. So you can tell kind of by your subgroup or what you identify as your risk for developing diabetes. So something to think about when you're asking your doctor to screen you and when you're going to visit your doctor for your regular checkups. So now we're going to move kind of into the symptoms of diabetes. So this is more kind of geared towards if you're already on diabetes treatment. Some of the medications can cause you to have low blood sugar, but just so you guys know, in general, with low blood sugar symptoms, we're kind of review that right now. There's a good picture there that kind of gives the sign or what I would think of when someone is having low blood sugar in terms of how they would look. Grabbing their head, kind of leaned over, not feeling so good. So some of these symptoms include weakness, feeling fatigued or tired, shaking, sweating, headaches, being hungry. You can have that hunger pain as your body is craving that sugar to help it run, nervousness or irritability are big ones. And they're all signs that show that a person's blood sugar is getting too low. And what I mean by blood sugar getting too low, for those of you who check your blood sugar regularly, anything under 70 is considered too low. So if you're ever feeling this way, you should have your blood sugar checked, especially if you're already diagnosed with diabetes, to make sure that your blood sugar isn't in those too low ranges. Now, there are things you can do when you have low blood sugar. So anytime you see your blood sugar under 70, you should have on hand with you some type of sugar-containing food, whether that be a little sweet or some juices or some juice to sip on to try and raise that sugar up. And we'll talk a little bit more about what to do when you have low blood sugar a little bit later. Or a little bit later, I mean right now. So to treat low blood sugar, so there's the rule of 15, so 15-15 rule. So if you check your blood sugar, you're having those symptoms, you check your blood sugar and your blood sugar is low, below 70. You want to abide by the 15-15 rule. So what that is you're going to eat 15 grams of carbohydrates and then wait 15 minutes and recheck your blood sugar. So what's 15 grams of carbohydrates, you're asking? So things like a half cup of fruit juice, a regular soda, 6 or 7 hard candies, or a tablespoon of sugar. So having, some juice around when you're out, or having it available in the car, having some hard candies on you when you're out should be something that, if you are diagnosed with diabetes, you should have on hand just in case you get to that low blood sugar range. Now, if you're not feeling better within that 15 minutes, you want to continue to intake carbohydrates. Now, you don't want to overdo it because you don't want to go on to the other end where your blood sugar gets very, very high. But you want to make sure that 15 minutes after you take that candy or that sweet or that juice, what have you, that you check your sugar. If your sugar is still below 70, you want to redo the process again until your sugar goes above 70. And then, so what I was talking about before in terms of the 2 different types of diabetes. So we have type 1 diabetes, which is our early onset diabetes, where the body fails to produce the insulin hormone. Usually this is diagnosed at an earlier age, so in children, adolescents. And so because your body is not producing insulin, the insulin is what allows the glucose to enter and fuel the cell. So like I said, our glucose is our gas in the cell, and insulin is the gateway to kind of pump that into the cell so the cells can utilize it for energy. And an estimated 5 to 10% of Americans are diagnosed with diabetes have type 1 diabetes. So it's definitely the less common type, not the normal one we think of, but it is definitely prevalent and can cause problems for individuals. Now, type 2 diabetes is what we usually think of when we think of diabetes. So that's the adult onset or the late onset. Results from insulin resistance combined with relative insulin deficiency. So things like obesity, excess fat that you carry on your body can cause insulin resistance, and then cause your insulin production to not be adequate enough to put the sugar or the glucose into the cells like it used to. And that's what causes you to have that high blood sugar. And it's estimated about 90 to 95% of Americans diagnosed with diabetes have type 2 diabetes. So it's definitely the more prevalent type, the type that you think of when you think of diabetes, and the type that we most commonly see in our practice that your primary doctor will see. I think button might have been stuck. Okay.
Sorry about that.
No, that's okay. So type 1 diabetes. So again, this is in response to high levels of glucose in the blood. The insulin producing cells in the pancreas secrete the hormone that is insulin. So our pancreas is responsible for our insulin production, and in type 1 diabetes, these cells are destroyed by the body's own immune system. So it's more of an autoimmune disease. So that's why it happens usually in younger individuals. Our bodies aren't producing the insulin that's needed. And so these patients will normally need insulin from a very young age to help control their blood sugars, and usually have things like insulin pumps, and will have to be very strict with their diet, be very good at carb counting in terms of what insulin to give themselves for meals and what have you. So this is a little bit harder to manage, but definitely manageable with the help of your doctor and good discipline in terms of what you're eating. And then type 2 diabetes, which is what we see more in our adult patients. Type 2 diabetes is a lifelong disease that develops when the pancreas cannot produce enough insulin, or when the body's tissues become resistant to insulin. And like we had talked about before, the increased adipose tissue, or for a better term, fat tissue in the body, can cause insulin resistance. And you also can have a genetic predisposition to develop insulin resistance, which is why genetics is a factor in terms of determining diabetes. And so insulin is a hormone that helps the body cells use the sugar or the glucose for energy, and also helps the body store extra sugar in muscle and fat and liver cells. So when your body is becoming resistant to insulin, you tend to not utilize the sugar the way your body was meant to, and so you end up having that high blood sugar, which can cause things like increased urination, can cause things like fatigue, increased thirst, which are some of the early signs of diabetes. And then talking a little bit about prevalence of type 2 diabetes among ethnic groups. So Hispanic Americans are 2 to 4 times more likely to develop type 2 diabetes than Caucasian Americans. And the prevalence among African Americans is twice as high as among non-Hispanic Caucasians. So the Latino and African American population are at higher risk to have diabetes. So just something to kind of keep in the back of your mind. To when you're asking your doctor in terms of screening, or when they're talking about screening for diabetes. And then, so when we talk about seniors, so the risk for type 2 diabetes increases with age. So the older we are, the less active we are, the more fat tissue we tend to keep on ourselves. Our weight kind of goes up. We've been, eating maybe not the right thing for a long time. So you're at higher risk of having diabetes. Approximately half of all diabetic cases occur in people older than the age of 55, and approximately 18.3% or 8.6 million Americans age 60 or older have diabetes. So it's definitely something that we see very commonly in the older population, so that population above 55 years of age. So we were kind of talking briefly a little bit about some of the symptoms of type 2 diabetes. So the most common ones that we see are frequent urination, excessive thirst and hunger, weakness and fatigue, frequent or slow to heal infections in the skin, in the gums, in the bladder, very frequent infections, blurred vision, numbness in the hands or feet. And these symptoms can range from mild or even go unnoticed for a long time. So that's why we, do, as your primary doctor, will do screening for diabetes so frequently, is because we want to make sure that we're catching this disease before it becomes before you have long-term complications from it. And while these symptoms can mimic a lot of other illnesses, it's something that always is in the back of our mind. Okay, is this something that is showing our first signs of diabetes? So especially with the frequent urination, the excessive thirst and hunger, those are symptoms that kind of signal to us, okay, this might be something that needs to be looked up or worked up. And so getting into the ABCs of type 2 diabetes. So the A stands for A1C. So what an A1C is, it provides an average of blood sugars over the last 2 to 3 months. Having your A1C levels checked at least twice a year by your provider is important for screening purposes with diabetes. So especially if you have a family history of diabetes, you're in that overweight or obese category, or you're not as physically active as you think you should be, we recommend that your A1C be checked. Now, if you do have diabetes, it should be checked pretty regularly, at least two times per year. And the suggested target, if you are diagnosed with diabetes, should be less than 7. So that's an average blood sugar less than 170. Obviously we want to get that to maybe even better ranges. So under 7, under 6 if we can. But our goal for better outcomes, and studies have shown that for better outcomes, under 7 is the goal we want to shoot for. Now, blood pressure is something that is commonly associated with diabetes. So blood pressures are important to check and to keep under control, especially if you have diabetes. So blood pressure checks at every visit and even at home should be something that you guys are frequently doing, just to make sure you're in good ranges. And our suggested target is 130/80 or lower. Now, you don't want to get too low. And what I mean by too low is if the top or the systolic number is 100 or lower, you want to talk to your doctor unless that's normal for you, and that's been like that for years. And if the bottom number is under 60, you want to talk with your doctor to make sure that you're not having low blood pressure. The C stands for cholesterol. Now, cholesterol, again, it's the ABCs, or that triad that we always look for when someone has diabetes. What cholesterol is it's a substance that your body does make, but we also intake it from the food that we eat. That really juicy steak, or that really fatty piece of ribs, or what have you, has cholesterol in it. And so when you eat that, your cholesterol levels go up. And so those that cholesterol in your body can clog the blood vessels, causing blockage, which leads to heart attack and stroke. And those are the main things that we worry about when someone has diabetes. We'd want to do our best to prevent heart attacks and strokes, because with diabetes, you are at a higher risk of having a heart attack or a stroke. Suggested target levels for cholesterol. So LDL, that's a fancy way of saying that's your bad cholesterol. You have good cholesterol and bad cholesterol. The LDL is the bad one. And you want to keep that cholesterol less than 100. Depending on the level of your A1C, there are other ranges, but that's kind of going a little more into the nitty-gritty of it. And you can speak with your physician in terms of what your specific LDL goal should be based on what your hemoglobin A1C or your sugar levels are. So grab a drink real quick and get a little dry. Excuse me. So contributing factors when looking at diabetes. So age is a big one, as we talked about. The older you get, the higher risk you have of developing diabetes. Usually the older you get, the less active you get, the more weight you gain. So something to keep an eye on. Talking about weight, that's why we are always talking about weight gain and talking about where you're at in terms of your weight, because increased weight puts you at higher risk for high blood pressure, higher risk for high cholesterol, higher risk for diabetes. And those three things together can be a dangerous mix, and we want to make sure we're controlling all of those things. Your family history. So like we had talked about earlier in the presentation, when your mother, father, grandfather, brother, sister, aunt, uncle all have diabetes, you're at a higher risk of having diabetes. So you want to make sure you discuss that with your doctor and tell them your family history in terms of, hey, diabetes runs in my family. I think I need to get checked more frequently. Your ethnic background, kind of like we talked about before. There are certain ethnic groups that are at higher risk for developing diabetes. The African American and Latino communities are among those. High blood pressure. So if you have high blood pressure, you want to make sure that you're controlling that, especially if you have diabetes, because those can cause long-term complications of diabetes, problems with the kidney, higher risk of heart attack, higher risk of stroke. Same thing with your cholesterol. So HDL, I know we talked about LDL before, but HDL is your good cholesterol. So you want to make sure that you have that at a higher level. So low HDL or low good cholesterol puts you at higher risk. The other part of your cholesterol panel that we look at is your triglycerides. That's more based on what you eat. The more fatty fried foods that you're eating, the higher triglyceride level is. The more sugary foods, higher carbs you're eating, the higher your triglyceride levels will be. Inactivity. I know every time we go to the doctor's office, they're always telling you, hey, you gotta get up, you gotta exercise, you gotta be more active. The reason we say that is because inactivity puts you at higher risk for diabetes. And then for my women who are in the audience, gestational diabetes. If you had gestational diabetes, meaning diabetes when you were pregnant, you're at higher risk of developing type 2 diabetes later in life. So something to think about if you are not in that category yet, but you did have gestational diabetes, is something to talk about with your primary care doctor. So consequences from uncontrolled diabetes. So the big things that we always look at with diabetes is heart attack, stroke, blindness, kidney failure, neuropathy. So heart attack, when your sugar is too high, your hemoglobin A1C is too high, you put yourself at risk for having a heart attack, and it's one of the the biggest and most dangerous complications of diabetes. You're at a significant risk compared to the average person when you have uncontrolled diabetes and high blood pressure. You're at much higher risk of having a heart attack or stroke. Now, with strokes, same thing. High cholesterol, high blood pressure, uncontrolled diabetes, those things put you at significantly elevated risks. That's why when you are diabetic, we're trying to make sure your cholesterol is under control, whether that be with exercise, lifestyle changes, or with cholesterol medicine, because we're trying to prevent those top two, heart attack and stroke, our main concerns in terms of preventing those from happening with patients with diabetes. Blindness is a big one. The number one cause of blindness in America is diabetes. So that's why we're always sending you to the eye doctor. That's why you should have regular eye checks, at least yearly eye checks with your eye doctor to check to make sure your vision is staying the same and not changing. Kidney failure is something that we touched on briefly. So with increased sugar in your blood, you tend to damage your kidneys, and that can put you at risk for having kidney failure or kidney damage later in life, which, if left untreated and uncontrolled, can lead to things like dialysis and need for kidney replacement or kidney transplant. So again, why we harp on you so much in terms of making sure that your sugar is under control, and why we're so adamant about controlling your blood sugar and your blood pressure. Neuropathy, I know at least someone in the audience has dealt with some neuropathy, basically nerve pains either in the feet or in the hands, that tingly burning sensation that goes down the legs. That's caused by what's called glycosylation of the nerves. So when there's too much sugar in the body, it goes to the nerves, it irritates the nerves, and those irritated nerves cause you to have pain. So that's what's causing that numbness, tingling, burning sensation in your feet and your hands. Those are the first areas that are affected. Usually those peripheral nerves at the far reaches of your body are the first ones that are affected by diabetes. And then overweight complications. So similar complications, stroke's a big one we look at. Being overweight in general leads to high blood pressure and complications, including atherosclerosis, which is basically hardening of the arteries, heart attack or heart failure, which after you have atherosclerosis, you have harder vessels that can be blocked with cholesterol. And when that happens, you're at higher risk of having stroke, higher risk of having heart attack. And then kidney failure, like we talked about before, kidney failure is a big one. Long-term or long-standing uncontrolled diabetes and long-standing uncontrolled blood pressure leads to kidney problems and eventually kidney failure. So that's why we're so adamant about taking care of your blood sugar and your blood pressure. So how do I take control of diabetes? If I've been diagnosed with this, what do I do to stop all these complications from happening? So there are a couple of things that we can do together, and we as physicians can help you along that path. So following a healthy diet, making sure you're staying away from a lot of simple sugars, whether that be sweets, sodas, fruit juices, simple white bread, a lot of grains like rice and tortillas. Not saying you can't have any of those things, but in moderation. And talking with your doctor or seeing a nutritionist to kind of see how you should be balancing your diet. Taking part in regular physical activity. We recommend 30 minutes of physical activity at least 5 days a week. So in total, 150 minutes a week of physical activity, whether that be walking, yoga, cycling if you like to cycle, swimming if you have access to a pool, whatever makes you happy that you're getting your heart rate going and getting that exercise, those extra steps in. Taking your medication, including insulin, exactly as prescribed. Now, it's very important that you're being, I'm blanking on the word, that you're being consistent with your medications. It's important that you take that medication every day, because a lot of the medications that we give for diabetes, they help regulate and keep your body normal. And if you miss a day or miss a couple of days, that sugar that's in your body, it's like starting from day one again, instead of instead of having a consistent level of sugar. You might be high one day, low one day, high one day, and you risk complications of not only having high blood sugar, but also having low blood sugar and having those symptoms that we talked about earlier in the talk. You want to make sure that you're testing your blood levels regularly. Now, everyone tests a little bit different. Your doctor will give you instructions on how often to test. Usually a fasting in the morning, maybe with meals, maybe once before you go to bed, depending on where you're at in the spectrum of diabetes. You should speak with your doctor in terms of how often should I be testing my blood sugar and how often should I get a regular blood sugar test via labs with you. And then see your health professional regularly. We love to take care of diabetes. We love to make sure that you guys are having the quality of life and being taken care of to the best of our ability. So please feel free to ask us questions. Feel free to discuss your exercise regimen and things like that with us, so we can, help you with our knowledge and our expertise in the area to help you kind of stay as healthy as you can and get that quality of life that you want long term. So importance of good food choices. So you play a major role in managing your diabetes. The most important thing you can control is to control your blood sugar is to eat a balanced diet. If you're overweight, you want to reduce your calorie intake to lose some weight. You want to increase your exercise as well. Losing as little as 10 to 20 pounds can improve your blood sugar levels, and also it improves the resistance to the insulin itself. There are many ways to manage how much and when you eat. Your doctor, a diabetes educator, or a dietitian can help you find a plan that works for you. So not everyone is the same. You need a plan that works best for you. So feel free to ask to talk to a dietitian or your clinician to help you with that. Regular exercise, we kind of talked about. Try to do moderate activity at least 2.5 hours a week. One way to do this is 30 minutes a day, at least 5 days a week. That helps control your blood sugar by using glucose for energy during and after activity. And it also helps you to stay at a healthy weight. It helps lower high cholesterol and raise HDL, or the good cholesterol, and lower blood pressure. So regular exercise is key in terms of making sure that we stay healthy. Taking your medication or insulin as directed, if prescribed by your doctor, is important. We want to make sure that we know what you're taking, that you're taking it regularly, so you get the full benefit of the medication, and that we can help. A lot of these medications have dual benefits, meaning they not only help you with your diabetes, but help you in terms of lowering your risk of having heart attack, lowering your risk of having stroke. So we want to make sure that you're taking those, so we know how to change your medicines if things start to go more to the uncontrolled side, versus if things are doing well, we know what to reduce on and what to take back on. Checking your blood sugar levels regularly as advised by your doctor. We kind of spoke on this a little bit as well, wanting to make sure that you're following your doctor's orders in terms of when to check your blood sugar and how to adjust your insulin or medication accordingly to what your blood sugar is. Now, one of the biggest things that I emphasize with my diabetic patients is foot care. Foot care is very, 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 very important. So when you have diabetes, your feet need extra care and attention. Diabetes damages the nerve endings and the blood vessels in your feet, making you less likely to notice when your feet are injured. Diabetes also interferes with your body's ability to fight infection. So you're at higher risk of having infections, especially in your feet, since they're so far away from the rest of your body. If you develop a minor foot injury, it could become an ulcer or develop into a serious infection. And ulcers can be found at the bottom of your feet, on your feet, or on the top or bottom of your toes. But with good foot care, you can prevent most of these problems. So you want to make sure you're checking your feet at least twice a day. So care for your feet is easily done when bathing and getting ready for bed. So I usually recommend for my patients, check your feet right after you get out of the shower. Make sure you're not seeing anything that looks like a cut or an ulcer or some type of injury, and right before you go to bed. Prevent injury to your feet by wearing properly fitted shoes and socks at all times. Steps to keep your feet healthy: examine your feet every day and have your doctor examine your feet during every visit. Check your shoes before you put them on. Make sure there's no rocks or anything inside. Don't use home remedies to treat foot problems. Over-the-counter medicines may contain chemicals that could burn your skin and make problems worse. And also trying to cut corns or calluses yourself could lead to infection. So if you're having those issues, let your doctor know. We'll put you in touch with the right people to take care of that for you. And get early treatment for any foot problems, even a minor one. You want to make sure that you're bringing it to the attention of your doctor and you're keeping eyes on those. And then you want to thoroughly inspect your feet daily and keep them clean and dry. And being prepared, we talked about this a little bit in the beginning of the talk as well. An individual with diabetes should wear and carry ID information such as an alert bracelet that emergency medical staff can find to let them know that you are diabetic, or if you have any other medical issues. And then a sugar source. So having those sugar tabs, having raisins or some juice in the car or wherever you're going, just in case your blood sugar drops too low and you need that extra bit of sugar, is very, very important. So I think I gave you guys a lot of information. I know you probably have some questions. What questions do you guys have for me?
Feel free, everyone, to just unmute, or you can just type it into the chat.